And welcome everybody to this episode of Empowered PAs. Today, we're going to talk about not only the pandemic, but really burnout. So there was burnout prior to the pandemic, and then now it's just been amplified with the pandemic. So we have, of course, Courtney Titus, who is the starter of Empowered PAs, and our guest, Kevin Williams, who is a psych PA down in South Florida. So welcome, everybody.
Thank you. Welcome.
Thank you.
So, Kevin, I've noticed that, I'm an orthopedic PA up here in the Panhandle. And, we've recently with the COVID-19 variant uptake, we had a lot more going on this, or at least numbers in our hospital, a lot more stress on us going on this go around in the hospitals and the ER versus back last year in March. Or the early days of when the pandemic was coming around back in 2020. And I know that's been similar in the state of Florida. I don't think we've had as many higher numbers as some other areas, but in overall compared to last year, in my area, the numbers were much higher. So that being said, I know the pandemic's affected me much different than, say, Courtney, who's a pediatric ER PA down in the Tampa area.
Yeah, I'm also in the Tampa area as well. And I know for mental health services, the area that I work in is the hospital setting, the nursing homes, ALFs, and in outpatient settings across the state of Florida in my role. And we are seeing a significant level of burnout in our providers as well. And then in the outpatient setting, actually starting to see an increase in healthcare providers who are needing and reaching out for mental health services. So we are definitely seeing the impact of COVID and the social factors that take place because of it in the area of mental health as well.
Well, I don't want to eat up every time with me speaking, but Courtney, why don't you give a little, a little bit of your experience, and then I'll be glad to share my experience of how COVID and especially this go around into, the Delta variant area here in 2020 has affected me. But, give us some insight of how COVID and burnout has been affecting you.
It's funny, and Chris, we've talked about this offline several times, but the thing that is interesting is that last year I remember anticipating feeling burnout, and with all of kind of that, I went through personally with my own family getting sick and then kind of moving through COVID, there was stress, but I don't feel like I started getting burned out until the beginning of this year for whatever reason. And then kind of as the year started progressing, I started really focusing on my own mental health and wellness. And I've kind of shared that journey a little bit. And I actually thought I was doing pretty good this summer. And, we went to FAPA and life was starting to make that turn and that pivot. I was really excited. And then Delta hit. And in the pediatric emergency medicine world, it's been truly just, the volume has been insane. It has considerably contributed to some morale changes in our own, kind of communities, at least in the pediatric world. It's been very stressful. And I feel in the burnout again. So it's back, and it's, but what's weird is now I recognize it. I remember this feeling. Oh, I know what this feels like. And I think I can kind of shift a little bit more easily, but yeah, I could spend an hour just talking about that experience, but it's been very challenging, mostly because it's our kids, right? Now we're seeing the kids and they're having not just COVID, but they're getting MIS-C and the post-COVID complications. And it's just devastating because these kids can't get vaccinated because they're age. So it's been a challenge.
Well, I'll speak briefly about, kind of my dealings, which is, it's been a lot different because in the orthopedic world, I'm not in the trenches with it. I'm just not. Back in March of 2020, it was really starting to move here in the U.S., more heavily, and the numbers were rising, but not necessarily in my area. And June, of course, I deployed overseas, and during that time, it was really spiking. So I had stressors, but it was COVID, what was going on back home, being separated from my family, And then, not knowing what to do and what's going on. And of course, all the news reports didn't help anything. Right. So that really stressed me out, especially being overseas. And then, of course, how we were, trying to do things that we were taking place over there to mitigate it. And one thing I know they did, not just overseas, but, in the US too, but they shut everything down. Like you couldn't, there was no, it was basically, I went to work, I went to my room and I ate. And they tried to, of course, with the whole social distance things, I had very little interaction or social interaction. So that took a toll, especially being deployed. I mean, that took a big toll on me being deployed, not having that, not that it's normal being deployed, but that sense of normal, interaction with people. And we found ways to get it, but it was still hard, especially being away from your families. But it wasn't that stress of seeing patients on a high load and being burnout from that standpoint, because my patient load there was not heavy. I mean, we were at that time, seems like the young and healthy were getting a pass, right? And so we didn't really have a lot of sick patients while I was there. Of course, COVID was there, but just not a lot of it. And then, fast track to now with the COVID-19 spike in our area, it was hitting a lot more. And I was getting a lot worried because, I like you thought, okay, we got the vaccine out now. More people got vaccine. We're not seeing the spike. You start to kind of breathe a little bit because okay, I start seeing the light at the end of the tunnel. But then our numbers spiked up. Our ERs were getting overrun. And it was, it was pretty much of all comers, but obviously it hit the young, healthy, and really, kind of that, around 50 to 20 something year old males, and definitely unvaccinated. I mean, no one can deny that the large, over 90% of it was unvaccinated that were getting admitted. And then, and then from that standpoint, the numbers went the same to going to the ICU. And then also the numbers were still equally that same percentage being, on ventilators. And so what I was seeing was just the stress of, well, my kid's going to get it again. They got it my entire family got it while I was overseas.
Oh
and
my
so
gosh.
and my mother-in-law almost died from it. And she's still dealing with the complications of it. And of course, the kids got it then. But even most recently, my son got it again. So he got the 19 variant, and he's dealing with the post-COVID now. And like you mentioned, in his post-COVID, and everybody's getting a little bit different. His is headaches. He gets random sharp headaches, and there's no rhyme or reason, why he's getting these headaches. It's not related to running. It's not related to activity. It's just, he can get it while running. He can get it just sitting down studying. So there's no rhyme or reason from it. And then you're finding people that are my age with families like I do that are being admitted and passing away. And so that put a lot of stress for me and worry with me. And then the jobs, am I going to keep my job? Are they going to downsize me, from my job? Are they going to furlough again? What are they going to do? Now, luckily they haven't done all that, but there's other PAs that's happened to the first go around. And then to add to that, I'm talking to my colleagues that are in the ICU, that are in the ERs, that, and I find myself just, feeling their pain and feeling their frustration, although I'm not seeing it firsthand like they are. I'm not in the ER seeing them coming in. I'm not intubating 5 people that night and 3 of them passed away, all COVID and all unvaccinated. And whereas the first go round, there was no vaccine. So you still had folks that were coming in and passing away from COVID. But now it's now we're taking it harder, especially us, at least what I can see as healthcare workers, because we've already went through all this once. Now we're going through it again. And now we're pulling our hairs out. It's there's a vaccine and people aren't getting it. Right. Granted, our kids, because of the age, can't get it right now, but, we're all feeling that stress, and it's weighing. And like I said, talking to my ER colleagues, my ICU colleagues and things like that. And just, I'm like, guys, are you taking care of yourself? And I hear I'm picking up an extra shift because there's no one else they need help. I'm like, but is that the right thing to do?
Yeah, mental health
That's
has
a good
not been
point.
a priority. Kevin, have you noticed that in your practice, have you seen that, instead of taking care of themselves, the healthcare workers are picking up more shifts to try to make up for the coverage, mostly out of guilt, I assume, because there's so much going on with compassion?
Yes, we have definitely seen that in talking with healthcare providers who are actually seeking mental health assistance. I was sharing with Chris earlier that we've actually seen an influx of healthcare providers who are actually seeking out mental health assistance, which is an area that's oftentimes a struggle to admit that they're needing the help and assistance. But I know my own mother, she works in ICU as a ICU nurse, and she already has several conditions that makes her compromised. And I'm often telling my mom, like, I understand that they're blowing your phone up to come in for another shift, but the answer is no, because if you don't take care of yourself, then we won't have you around any longer. And seeing that my family has gotten COVID, my mother was hospitalized due to it, and it's affecting healthcare providers. She just messaged me yesterday and was mentioning that one of her patients, 40 years old, came in and died, and she just lost it. She's been going 4 days, 5 days straight, and she just lost it. So she was taking several days off to really just allow for her mental state to improve. But yes, it's definitely a level of guilt, and they're in the trenches and facing what everyone else is facing. So they want to give their part. So yes, just considering like how beyond this, the how it happened, COVID, right? But really trying to understand why it's affecting us so bad. I thought that through the fact that we as PAs and just healthcare providers, nurses and NPs and doctors, we all got into this to solve this problem. We wanted to be a part of a solution. And I find with the first wave in 2020, we were all working through getting the solution. And then when, like, I remember in that August, September period, and then we had FAPA and it was virtual, and it was just a sense of like, we'll get back together a little bit. And it was always like, oh, next year we're going to be back together, going to be a whole different process. And then when the Delta variant started and it just went through all these areas, those solutions and the support that we were accustomed to were all stripped from us. And I find that's where we as practitioners, and I know we haven't started talking about solutions, but for me, I've really been getting to explore, how do we identify I'm becoming one of the statistics of burnout? And the first for me has been really beginning to identify and chronologize my stressors. What are the things personally, in my occupation, socially? What are those stressors? Writing those down and admitting those. And as healthcare practitioners, PAs, we're not the best at that, right? We're going to go spearhead, because one day there'll be the solution. We'll have the support. So I'm going to stand in the gap. Well, that gap is becoming this long period of time. And that's where, for me, I find practitioners just spent getting divorced, not seeing their kids anymore, quitting their jobs, leaving their jobs, going on the clock, but not working like they were working before. So that's another problem ethically, and just exhausted, but can't stop, because if they stop, they lose their jobs and they're afraid of that. So it's just a perpetuating problem that we've seen in my offices and where I've been working with individuals.
Well, I mean, I think that kind of, you kind of segmented into kind of double thing here. So there's burnout. This topic has been ongoing for years before COVID. just your personal burnout with whether it's you made it yourself, whether it's demand that the healthcare system prior to COVID was placing on you with, how you see your patients, how you're taking care of patients, EMR. Oh my goodness. I remember sitting in the orientation with a new physician and the IT person said, well, it's just one more click. And he goes, if I hear just one more click, one more time, I'm going to lose it. But he's right? He's right with these EMRs. Yeah. It's death by clicks. Yeah. And so I really felt his pain. And when you're that EMR person or that administrator or that IT person, you're thinking this is all great, it's all automated. They don't understand our end from that, how it takes away from that patient care. And that's how we got into this field, is taking care of patients. But so you had that, and you mentioned it here. What are your stressors? It may be related to work, and it may not be related to work, and it may be on compound too with things happening at work, family life, work life, the drive in, what have you. But then with this COVID, it's amplified everything. It's put a spotlight on all kind of problems in healthcare and just in just society in general. So I have noticed that. You mentioned people quitting their jobs. That's been a big problem lately. Yeah, a lot of people, some people, physicians, PAs, nurses, older in age, close to retirement anyway, they're like, you know what? I'm done with this. I'm going to retire. I don't blame them, right? I don't blame them. But then some of our colleagues are quitting just because they've had enough. They've given all that they could give, and they're finding a different career.
It's funny. I had this conversation, and I think, Chris, this is what you and I had talked about a while ago, is I had this conversation with one of my colleagues, and we were just casually chatting, and we were both kind of in agreement that we used to work in the ER. You tend to work like block shifts, right? You work several shifts in a row, so you have several shifts off. That's just kind of like, that's the lifestyle of an ER PA. Well, we were both kind of saying simultaneously that I can't do more than 2 shifts at a time, or it takes me so long to recover. By the time I'm finally like feeling back to normal and feel like I'm recovered after a shift, I'm going back to work. And it's just what used to be this, like, I can work 5 shifts in a row and then have 5 days off. We just can't do that anymore. Like the cognitive load of all of the change and the stressors and the like life stuff, when you're at the gas station, you see crazy people on TV. It's so much that we just can't do it anymore. And that changes medicine too, right? Like, it's insane to kind of think of the different permutations and the ripple effect of the whole thing.
Well, I find the same thing with, go ahead, Kevin, I'm sorry.
Oh no, I was going to say, and Courtney, that's the I'm smiling because you would have thought that you and I probably talked before. My second thought was that we really need to create new boundaries.
Yeah.
Like oftentimes it's that very same thing. Like, oh, I used to be able to do this. Like, what's happening? And folks are like, I've gotten COVID and I'm not able to sustain. I'm not able to go. I haven't gotten COVID, but I'm not able to sustain. I'm not able to go. We have to identify those new boundaries and then stick to it. I don't know what to say, but I can't do this.
Do you think they know how to, though? Because I can tell you I didn't. I had to like actively seek out what was going on. I had no idea. I really had no idea what was triggering me and what was causing those problems, and that I was not setting those boundaries. Do you feel like that they know?
I don't think so. And that's the major issue is until something tragically happens, and then they're faced to admit some things. But no, because it's the personality of most, and I'm going to use the word healthcare professionals. I don't think this really, it just pertains to PAs. I think this is across the board. There's medical assistants and front office and registration clerks and so many folks who have to deal with us in healthcare that are, I was talking to a provider just last week, and she was like, I show up to work, I'm doing all these things, and then the medical assistant midday just walks out and quits. And then because we don't have anyone else, she comes back next week and we have to accept her. And like the games mentally that's played there, like, how do you walk out on us as a team and then get to come back and we have to accept you because there's no one else?
Oh, that's awful.
It's those aspects that I'm seeing in mental health specifically that's driving depressive rates and driving issues with sleeping and insomnia and several other mental health conditions. But yes.
I tell you, you mentioned insomnia, and that's something I've dealt with a lot here lately. It's just those nights where, I mean, either no sleep or one sleep, and it's not because I was up working. It's just, my mind wouldn't shut off. So Kevin, you mentioned this, and I think we've all touched on it. What are some signs that we as healthcare providers or anybody in general should watch out for signs of burnout?
First, changes in mood in personal relationships. Because we have to perform so well in the professional settings, normally when we're home, our family members, or if you're living with someone or friends, they're going to identify that your mood is changing. I know for me, my wife did. I wasn't accustomed working from home. I was now seeing patients 35 via telemedicine. And, it's small things like they can't figure out how to log on. So they're 30 minutes late and I still have to see them. It was those small things. And my wife just made mention to me one day, and she was like, I was coming home and, I was leaving this office and going out, and I was having a glass of wine every night. And she was like, is it really that bad living with us? And I was like,
I don't mean to laugh, but
no,
I can hear her say that.
No, yeah. She's like, is it that bad living with your son and your wife? And I was like, no, what's wrong? And she's like, well, I'm noticing a change in your behavior. Point one. Whenever folks around us who are really close to us, not in the professional setting, but in our personal setting, starts to share, whether they're allowed to or not, when they start sharing changes in mood, that's major issues. You're already past, you got to make some changes. But normally, because it's not affecting us in our professional setting, we're going to still continue to drive on and move on. But that's really where you have to identify something's wrong, and I need a third person to really help me identify. And this is not just a pitch for mental health,
right?
But I believe every healthcare clinician needs to be seen by someone else to help evaluate their current mental health status. It's not that there's a diagnosis that's attached and the stigma that comes with it. It's just, let's just call it COVID. Like there's some sequela because of COVID and because of our current healthcare system. And we need to have counseling, and we need to be evaluated by a psychiatric provider to just say, you're good, start with counseling. But yeah, insomnia is huge. It's huge. The mind isn't turning off. And what we're going to turn to is some alternative measures. So yes, you're going to start consuming larger amounts of alcohol. I'm not calling you alcoholic. You're just consuming it. You're teetering with your cage, right? And we don't want to admit those things.
Those numbers on the cage is going up.
Yeah.
So you may
be once I'm performing well in my professional setting, and the people around me in my professional setting don't see it, then we as PAs, nurse practitioners, doctors, DOs, whatever, we're good. Because the one thing that we said we were going to always be is great healthcare clinicians.
Well, you mentioned that fact that your wife brought it up, and I already know the answer. Did you find yourself not blowing her off at first and not believing her?
Actually, because of my wife's relationship, and I think because I'm in mental health, I scheduled a counseling appointment. I have a counselor that I go to. I'm in Orlando, and I drove from Riverview all the way to Orlando for an appointment that Friday. Because just her saying that, it triggered for me something was wrong. Like I got kidney stones because of it. Like I was a mess.
Yeah.
Not that I was drinking. I was only having one glass, but that's not my custom. I'm normally one drink on a weekend or once every other week. But it was like just to deal with being on multiple phone calls about nothing I could solve, dealing with all of these issues, folks losing their homes. It was just horrific that I was like, I need something to be able to function with the family. Give me 15 minutes and I'll be back.
I gotta commend you, man. That's like, if for you to immediately make that phone call and be like, I gotta go, we're gonna be going. That's like, props to you. That's huge. That's a huge deal.
So I was not that quick. So the first time I was like, whatever, I was like, whatever, just, you know what you're talking about, right? You're just being the nagging wife. You're just being the nagging wife. And I've never like jokingly, I've picked up my wife about being nagging, but I've never really just called her nagging wife. At that time, I was like, quit being nagging, quit nagging me. Right. And then there was one time, and I still joke about this because it's still a funny joke one time. And because it's similar to what you said, I came home, I fixed a drink. She goes, I mean, do you really have to have a drink when you get home? I looked around and saw all my kids screaming at the top of their lungs and just piercing my ears. I looked around and said, yeah, I do. just that example right there. Yeah. To get through this night, I need this drink. And so we kind of stopped there, but that for me, that was just a funny moment that I thought I'd share with you guys. But yeah, so number one is that people started noticing change about your mood and behavior. What's another one?
Decrease in your performance.
Mm-hmm.
We typically mask that by focusing on what we're doing best, but actually really evaluating what we're not doing best. So I'm spending less time because I have to click a bunch of buttons. For individuals who are outpatient, my refill request list has doubled. My callbacks are going further out. Really starting to notice decrease in proficiency and performance is another large area that, in my experience, I've begun to see with healthcare providers that something's wrong. There is this issue with once a provider obtains COVID and undergoes the process of quarantine and all those other items, there's fogged brain. We're seeing some memory loss. Actually, and I'll share this here. I've actually opened up my own private practice where we've been scanning brains in our office. And every healthcare provider, I actually scan them to assess right now where they are. And then over the course of 6 months, we'll retest them to monitor the brain waves. But we're seeing insomnia in folks who've never had insomnia before, sleep disorders, memory loss, and not answering questions correctly as we're testing their brains. But they believe that they're functioning well until they see those results. And then we start having that tough conversation.
So what type of scan is that you guys are doing? Is that
So it's a brain view. It's a 21 lead EEG, EKG, pulse ox, and evoked response potential. So ERP. And it takes about 40 minutes to some things that they have to do. They keep their eyes open, try not to blink for 5 minutes, close their eyes for 5 minutes. We begin to see drowsiness through that period. And then there is a series of about 30 minutes where they go through different test questions and they're asked. And really what it's doing is it's evaluating their endurance. So I've had a counselor that came into the office and was being seen. And their issue was they've not been able to maintain 1 hour sessions. And for counseling, it's normally 1 hour. And this particular person was mentioning that, it's only been 20 minutes and they're making some excuse for why, like, they're like, we're done for today. We're going to pick up next week. And they were recognizing that. So they came in to get evaluated and we see their stamina is gone. So I had to tell the provider, like, hey, you're going to have to start doing 20-minute sessions until we can work with you to get you back up to your hours, but you're not going to be able to have an hour anymore. So what does that do, right? It scares the provider. They're not going to be as effective. They're going to have to work, 3 times harder to get to their 60 minutes. You're going to have to see more folks. They're going to have issues with their employer, right? All of this anxiety comes up. So they stay up at night. not being able to sleep, just thinking about the fact that I could potentially be fired next week.
That's so interesting. So I sought therapy last year after I went through a pretty stressful year. And the reason why I did that was because my memory was changing. I was like, I don't know what's going on, but I can't recall what my patients' families are telling me. They'd tell me something, I'd have to go back in with a piece of paper and write it down. I'd sit at my computer and completely blank. My notes were I was staying an hour plus after work to just finish notes because I was not being as efficient. I'm like, something is wrong. And our volumes were very low. Like, there's no reason that should have been happening. So that's so interesting. And I had no idea. I was just like, something's wrong.
I wouldn't know. That would not be a good sign for me, not remembering something, because that's been something that's been dealing with me for probably since I was in high school.
Well, I can tell you, as a healthcare provider in the middle of a pandemic and suddenly having memory changes, like I thought, like, did I have some kind of intracranial process?
Right.
Like I was legitimately like differentialing myself, and it was this stress. You know, my father had COVID and almost died. He was intubated and hospitalized. It was awful. It was awful. And then my son got diagnosed with a chronic illness, and then we had, financial stuff with like potential job loss, and there was questions there. So like it was just a hard year, and I was just finding that I was struggling, and I didn't pick up on it. It took me like probably a month before I was like, I've got to do something up, because I legitimately was just like, something is wrong with me and I can't figure it out. So that's so interesting. I wish I'd talked to you beforehand, Kevin. That would have been very helpful.
I know.
And it, to speak to therapy and, starting with a therapist and then, following up as needed. It's like, I think that the other piece of this, I can just say, is that there's a lot of like stigma as a healthcare provider. There's, some people think that if you're diagnosed with certain illnesses that you're no longer able to work, because there are a lot of questions when you renew your state licensure about your mental health, which is a completely separate topic than from what we're talking about today. But I think that the stigma isn't just the social stigma of seeking out therapy and, trying to seek a diagnosis if that's the case, but also like there's this whole other legal element. And so I feel like people they don't want to go there from the general stigma, and then you add that extra layer of complexity to threatening your job. And it's just one of those things that I think healthcare workers especially, are going to shy away from. So I'm really glad that, people talk about it like it's a normal thing. It's normal for healthcare providers who are in a stressful situation, and we have stressful jobs, to seek out help and have somebody to listen to you. I think that's really important.
Yes, I agree 100%.
So Kevin, we talked about the change in mood. We talked about decrease in performance. Is there any other indicators that we should be watching out for, or is that kind of like the top two, or is there other ones that you've seen?
Those are the top two. The others are normally more in the extreme cases.
Yeah.
And that's again when their personal lives or their professional lives are significantly altered and they have no control. The biggest part is that as healthcare providers, we're trying to maintain some sense of normalcy. So when their personal lives are changed, right, either a spouse leaves, there's infidelity or anything to that nature, or just loss of love, or in the job setting, demotion or transferred or furloughed or any of those cases, it cascades into other issues. That's not everyone.
Right.
But I feel as though when we start talking and going back prior to COVID and going back into joining into the profession of healthcare, there's kind of been a spiral slowly unraveling of what they've tried to maintain, right? So we as PAs and NPs, there's a level of competition for every job opening that we're all trying to maintain. So we have to keep up with something. So it's said, it's been posted, and you see it all over social media, but it's really okay not to be okay. And the questions on our licensure and the legality parts of that versus us actually getting the help that we need. Some providers just pay cash and they try to do that. And I try to explain to them, you coming and seeing me doesn't indicate that you have this chronic mental health disorder that you're unable to treat individuals. This means you're human. You are a human being that is experiencing life and you're needing assistance. Congratulations for admitting it and coming in. So affirming that their decision to come in, really apprehensive. Some of them will cancel their appointments, but getting into the office and really talking, and then meeting someone who's able to communicate, right? Not speaking over you. We're in the trenches together. We're working through this. Let's get through this together. Finding those type of clinicians is so important to being able to be open. Yeah.
So Kevin, you mentioned, obviously right away when you like your example was when some of those signs came along that you went and saw your, your counselor. Mm-hmm. So we know we need to find someone to talk to, preferably a third party, preferably someone, that knows what they're doing, right? I mean, at very least a good friend, but you really want somebody that's trained in this type of area. But what are some other things? And Courtney, I'm sure you can speak on this too. I know we've talked about different examples that you're doing that we can do to help mitigate some of this stressor in our lives and kind of reset almost. I love taking vacations, but I try to tell some of my colleagues, hey, you need to take a vacation or something, but they're like, I can't do it. I got to keep working. But what are some things to do when you really can't take a vacation? You really can't take that time off, whether because you just got over being sick or being at home with a loved one because they were sick, but you still need that help.
You want me to go? Because I have so many things.
I'm gonna let Courtney go first, and I'll close it out.
All right. We'll let the professional handle the professional piece of it. I can just tell you what I did, and I can tell you as soon as I kind of recognized that I was kind of back in that burnout cycle. I was still in contact with my therapist, and we were kind of working through it. And one of the first things that was said was, "Your yeses are very messy." And I was like, wait, what? And what he was trying to get me to realize was that I just kept taking on things. I don't know if it was to keep myself busy or because I felt like my world was falling apart. And if I just kept saying yes to the things so your yeses are very messy, like hit me like right to my core, like so bad. So he's like, take, a few weeks and just stop taking on, don't keep putting water in the boat. And so saying no was probably the first thing. And then I took about 6 weeks and I think Chris, I said no to at some point because I was like, I am not doing anything.
Yep.
Next 6 weeks, I'm going to clean up what exists and then reassess and kind of see what kind of falls through. I stopped doing our virtual shadowing events. I stopped kind of everything. That helped a lot. At the same time, I started journaling, and Kevin, you said it perfectly, is like recognizing your triggers means you have to pay attention to yourself and ask those, like, it's also getting curious about them as like, why is this bothering me so much? Right. And so like, I started with prompts. I'd never journaled before February BTW. That's not a thing that Courtney did before this year. But so I was there's a couple of self-help books that I really liked, but they kind of gave me ideas for journaling prompts. And one of them was what I witness and what I can do about it. And that was it. It was just like, and so I found myself like, if I was really frustrated, I am really frustrated at the end of this shift today. What is going on? It was a kind of a normal shift. There was no real sadness. There was no real excitement. Why am I so frustrated? And then kind of figuring out, it's because it's my 4th shift in a row and I didn't sleep at all last night. And, I haven't seen my kids because our schedules have been off or whatever. And it was like really getting curious about my symptoms, if that makes sense. That helped a lot. I filled a journal in like 2 months, like just filled it up, just writing, stream of thought kind of stuff. And there's more, started doing like the headspace meditations are like 5 minutes. Also meditation, not a thing that this girl has ever really done. Like it's too woo-woo for me, but it's not even meditation. It's just quieting your mind. Like it's just being quiet and kind of like paying attention to your environment. 5 minutes a day, that and the journaling and the just like self-reflection and saying no were like my big top things. And that made a huge, like, it just gave me a room to breathe, and that gave me some reflection time. So I don't
So if
want
I
to
can
take
share,
but go because you got
I want to share something that is gonna. I learned this. I'm currently in the process of going through some intense training for therapeutic services with EMDR. And as you look at the amygdala, it has no time or space. So through the traumatic events, and that's where a lot of our traumatic things stay in our brain. So it replays over and over. And that's really what causes the issues, or it's believed what causes a lot of the issues in us staying up and not being able to sleep. So with your meditation and you recognizing, and you use that word curious, I love that, becoming curious as to why, it allows for you to move some of those things from the amygdala into the part of the brain where you can process it and let it go. So the journaling makes you see it, right? You have to write it. So you're processing that you're actually writing these words, which is why we have our kids write down their spelling words 5, 10, well, at least my son, he has to write down his spelling words 5 or 10 times, per day to get his spelling words right. So we do that. But I wanted to share that what you did matches the research that's out there in our brain, which is why brain view is so important to me, because you can see it, fix it, and then show the person you don't have it anymore. You're good, right? So we move from this subjective, oh, I feel a certain way, to hard evidence that's there, and you move forward. Great. I love it.
That's awesome. That's awesome. Is the amygdala, that's the limbic system, right? That's kind of the emotional section of the brain. Yeah, that makes sense.
And through stress, cortisol, it actually begins to enlarge the amygdala. It gets larger and larger in size.
Really?
So that is, yeah. And then that cortisol is this uninhibited process. Sorry, I don't mean to get all scientific.
Oh, nerd out, man. You're in good company.
But it begins to enlarge. This past weekend, I did a course for a bunch of CEOs discussing stress and CEOs, right? And really identifying what does stress and cortisol do to the body. So we see several issues that we all understand metabolically, but that amygdala in the limbic system begins to enlarge in size.
That's crazy stuff. It's very real too. And it's hard evidence as a pseudoscientist, right? A medical scientist, I guess, that it speaks to the realness of, you kind of feel, and I hate to say this, but you feel like you're crazy. Like, why can't I handle this? I've always seen, I'm a paramedic. I've seen things way worse than this. I've dealt with things way worse than this, but it feels so real. So I like hearing that science behind that. I think that's truly speaks to kind of what's going on for people. So very interesting.
And that was the passion, really, to go, and open my own organization. Was I was tired through COVID and through all of this, just mega company, right? Go see patients, go do this. And I was like, no, we got to change this more to quality. Let's treat folks for a reason and fix that. So good.
So Kevin, with your new the new clinic you've got going on, what's your focus? I guess repeat some of your. I know you've touched on it. What's your focus? Is it all comers, or is there certain I guess area of expertise that you're focusing on?
So honestly, in the full lifespan, so seeing adolescents, children, seeing adults and geriatric populations, our vision for On Point Behavioral Health has been to clear the path for personal transformation. So in doing that, making sure that individuals have access to care. So you're not waiting 3 months to see a provider, ensuring that you have accountability and ensuring that there's compassion through your care. So we all have the risk of it being faced with mental health and not treating you like you have an issue, but this issue needs to be addressed. So let's do it together. And then ensuring that we're innovative. So the goal of our organization is to redefine mental health, how it's treated, how it's being done. So spend a lot of investment in innovative approaches to treating individuals. So when you come to our office, whether it's virtually or whether it's in person, your experience is totally different than going into several other offices. It's serene. Everything has been intentional from the time you call in until the time you get your prescription of medication or sent to a counselor or a therapist. Everything is intentional. There's follow-up. We're checking on you. We're making sure that things are done. So we're not worrying about the volume of patients. We're worrying more about the quality of care, because if folks get better, then they're able to learn these techniques and then they are healed. They're transformed, right? Yes, you might still need a medication long-term, but your process and your ability to journal and to meditate and several aspects, then when the next hurdle comes, you have the techniques and you know what to do. So that's what we do.
So for those that, maybe searching out for your clinic, is there a website they can go to or a phone number they can call or anything like that?
Certainly, yeah. And we treat folks all over the state of Florida, but our website is www.onpointcare.net. And the phone number is 813-803-2999.
All right. Well, perfect. So we're coming up on an hour now. So those of you that are listening probably don't want to listen over an hour anyway. There's a lot of great topics that we touched on tonight. Most of it, obviously, burnout and how to spot it and some techniques to deal with it. There's a lot that we went over that I think we could probably just have another hour on so many different topics that we just briefly touched on tonight, and I can count on. So Kevin, would you be willing to come back and do another topic sometime?
Certainly. I am excited. Thank you for the invitation to come and talk about a topic that's not widely discussed in our community. So thank you to you both for the invitation and for allowing me to come and share.
Well, we really appreciate you being here tonight and for this recording. And then those of you that are listening or watching on YouTube, make sure you go on the YouTube channel, hit the like if you like it, and then share it with your friends and just let everybody know about the topic and know more about. They can find out more about this type of information on empoweredpas.com. And so we really appreciate everybody tuning in.
Absolutely. Thanks so much, Kevin. And we'll make sure that we have all his information on the blog post so that everybody has access to it as well.
Thank you so much.
Thank you.